What if that's the thing? And that's the fear. What if that's the thing that does it? What if getting care is the thing that actually, what exposes me?
Welcome to Your Body, the healthcast that takes a deep dive inside your health. No matter what kind of health issue you're experiencing, whether it's the common cold, a bad case of eczema, heart disease, or breast cancer, it affects you in every way, physically, mentally, emotionally, and internally. This podcast seeks to understand what is going on with our bodies from the inside out, from our heads to our toes, and everything else in between. We're going to look at health issues from every angle and hopefully get a better understanding of what's going on with our bodies and how we can better take care of them. I'm your host, Stephanie Landon, editorial manager at RadNet, a leader in outpatient imaging services and an advocate of patient empowerment for over 35 years. It seems impossible to begin a podcast about healthcare and not look at some aspect of our current health environment. Of course, I'm talking about the coronavirus pandemic. When it first really hit the United States in mid-March, aside from the staggering numbers of people getting sick and dying, we were also confronted with massive shutdowns. Not just restaurants and shops and hair salons, but also doctors' offices. We were told to only seek medical care for emergencies or essential health treatments. We were advised to put off dental cleanings and physicals and mammograms. And now, months later, despite the fact that most doctors' offices, dentists, and imaging facilities have opened back up, people are still avoiding them. A recent New York Times article reported that nearly half of all American adults have skipped or delayed some kind of medical care since the beginning of COVID. And there are even more frightening statistics. In the month of March alone, one report showed that preventative screenings for cervical, colon, and breast cancer plummeted as much as 96%. The National Cancer Institute estimates that there will be an additional 10,000 deaths in the United States in the next 10 years from colon and breast cancers. And they add that this number is considered conservative. So all of this begs a question. Are we headed for a secondary health crisis in this country?
Undoubtedly, there will be an impact that will be felt and detectable down the road. And I'm a breast imager, so I could speak to breast imaging, but certainly that will hold true for colon cancer screening, prostate, and so forth, and the common breast cancers that we encounter in healthcare. I think there will be untoward consequences from the disruption in the routine screening paradigms that exist for these diseases.
This is Dr. Jason McCallop. He's a board-certified radiologist with fellowship training in breast imaging and the medical director at BreastLink Tarzana, located in the San Fernando Valley in California. He has said that the culmination of his life work has been dedicated to finding small breast cancers before they grow and spread and become deadly. He says that there's a 99% 5-year survival rate if you find a cancer when it's still small. So when I read a recent study that said 1 in 3 women delayed their mammograms because of COVID, and that nearly 30% of women said that in general, their breast health has become a lower priority since the beginning of the outbreak, I wanted to speak to him. Hi, it's Stephanie Landon.
Hey, Stephanie, how are you?
I'm good. How are you?
Pretty good.
Thank you so much for taking the time to talk to me. As a breast imager, I've been reading that, some experts are still saying to patients that only, women who are high risk should be still getting their mammograms. So what do you say to this? Certainly
medical related or surveillance or screening related to some of these healthcare issues, including breast cancer, is a lot safer now than it was at the very outset when our knowledge of COVID was quite limited. So it is somewhat of not necessarily a moving target, but an evolving situation in that we now know a lot more about COVID than we did at the outset. And I would say that it's a lot safer now compared to the outset when perhaps only the high-risk patients should entertain, going out into public even to get their screening. At this point, I would say that most centers, if not all, have made accommodations for the virus and can safely get patients in and out of their facilities to have a mammogram done safely. and to effectively screen the average risk population as well.
Regardless of what's going on, it's important for women to get their mammograms.
Oh, absolutely.
Yeah.
Absolutely. There's about a 30% risk reduction in lives lost relative to patients who don't get screening. So breast cancer related mortality is reduced by about 30% in patients who get screening regularly versus those who don't.
Right.
So that's significant in terms of lives saved.
Yeah. Do you know of patients who have avoided their mammograms because of COVID?
Yes. In fact, we encounter patients not infrequently, more recently, that have avoided coming in for that specific reason. They hesitate to not only get their screening exams, but there have been patients who have, may have been recalled from a screening mammogram at the end of last year who decided that they would come in at a later date once COVID settled down. Obviously, the situation with COVID is fluctuating and evolving by the day, so it hasn't really settled down. One could argue that it's still uncontained in our country, unfortunately.
Yeah.
So yeah, there have been patients actually who've come in to see us in delayed fashion, and one of them that comes to mind actually is an unfortunate circumstance. I wouldn't say it's an unfortunate story because it's very recent, and I think with the appropriate treatment, hopefully this particular patient will find some success in her treatment. But it was a young mother in her 40s. She was a single mom of two children who first detected a lump in January. She made the decision at that point that she would keep an eye on it and basically, follow it through a couple of menstrual cycles to see if it went away. But because of the pandemic, as well as her obligation at home to her two young children, she decided that she would actually put off coming in to get it evaluated. And she didn't do so until late July or early August. And by the time we had seen her, she had a fairly sizable lump in her breast, which we biopsied, and it turned out to be one of these aggressive types of tumors that I was discussing earlier. Mm-hmm. And it had unfortunately spread not only to the lymph nodes under her arm, but to other parts of her body. So fairly advanced disease. And we can only really theorize or postulate what would have happened had she come in earlier. It's pure speculation. But with these aggressive cell type tumors, we see faster spread and faster growth of cancers. So, time is essential, and it's a significant factor in determining, survival and long-term outcome from the disease. Mm-hmm. So that was one unfortunate example, but it's a very recent example, and there have been advances in treatment, and I'm hoping that this will be a successful treatment course for her.
Yeah, I hope so too.
Yeah, it's serious stuff. I think people, all patients, or just humanity in general, should consider their health outside of COVID as well, and to not neglect certain things that we typically didn't neglect pre-COVID.
Almost every aspect of healthcare is suffering, and it doesn't matter about what the disease is.
Dr. Judith Rose is the medical director of PET-CT and clinical research for RadNet Management. She's been practicing medicine for over 45 years, and she's one of the leading PET-CT radiologists in California. I was able to reach her just before she left for a long overdue vacation. I wanted to ask her about other diseases and healthcare issues and what kind of impact clinicians are seeing from a broader perspective. We've been speaking with Dr. McCallop about the delays in screenings and treatments for breast cancer. So I wanted to talk to you about what numbers are looking like with regard to other cancers and health conditions. And I'm curious if we're seeing similar declines in those screenings.
Many of the statistics I'm going to quote right now were published at the height of the pandemic. although there's some improvement, the impact will continue indefinitely. Comparing January 2019 to April 2019 to the same months this year in 2020, there was very significant decline in screening exams for breast cancer, which dropped almost 90%, and colorectal cancer, which dropped 85%. When we look at American adults, almost 50% of them skipped or postponed some medical care in the last 3 months. Another example would be people who go to their primary care doctors or GI doctors. They've declined since the beginning of COVID, 49% and 61%. All of those numbers will have significant impact into how those patients care and what is happening to them with their multiple physical conditions after COVID and as COVID continues.
Dr. Rose says that COVID is even affecting patients who are currently in treatment for cancer. She mentioned a study that said nearly half of the polled breast cancer patients reported delays in care. And we're talking about women currently undergoing chemotherapy, radiation therapy, or waiting for surgery to remove tumors. Dr. Rose says these facts will undoubtedly be impactful. So what do prognoses look like for these patients?
Well, I think a good quote is from the director of National Cancer Institute, Norman Sharpless, and he issued a warning early on about the dangers past, present, and future to cancer patients, and he said he expects a great many more deaths. I think what we're going to see, though, is something that's on a more impactful than all the deaths, and that would be we're seeing people with later stage cancer at initial presentation. So what does that mean? That means that instead of an early cancer, we're seeing the patient of a later cancer, which means more aggressive treatment has to be done. And perhaps they're even presenting where there's a spread of the tumor, which would not have been possible or present as if they had been diagnosed early on. So they're being what we call upstage. You want the lowest stage of cancer possible when you're diagnosed, because the higher the stage, the less likely you're going to survive. And there's been a lot more patients we can see on the imaging side who have extensive disease, greater than would have been expected because they delayed coming in to see their doctor, and then the imaging was delayed. And by the time all of that happened, now they have much higher stage disease.
Well, I asked Dr. McKellop this question, and I want to ask you your thoughts. Do you think that we're headed for a secondary health crisis in this country?
Absolutely, unfortunately. We've been pretty much focused on cancer talking today, but this is not just a crisis in cancer. This applies to all diseases, heart disease, strokes, liver and renal disease, to name a few. People are not going to their physicians when they need to, and when they get there, many times they're much sicker than they would have been if COVID hadn't come along, and it's going to be harder to treat them, and their survival is not going to be as good.
I'm still struggling because I don't know. I still don't know if I feel comfortable with how much risk to take.
I called Stephen Craig because I wanted to get a patient's perspective, someone who knows he has a healthcare issue and needs to go into a medical facility, but because of his fears of COVID, he's been putting it off.
Hello.
Hi, Stephen.
Hi.
Hi, it's Stephanie Landon.
How are you?
I'm good. How are you?
Good, thank you.
So I know you mentioned to me a little bit about something going on with your knee. What's going on with that?
Well, good question. A few months ago, I started getting this really sort of gnawing kind of pain in the knee that I guess I would have to describe as probably arthritic. And so reached out to my GP, and he actually referred me over to, who was the other specialist? Anyway, so they've ordered blood work, and they want to naturally see it on an X-ray. And I put that off for quite a while. Just because I felt like the knee is not, yes, it was painful, but, visually looking at it, there didn't appear to be, the kneecap wasn't on the side of my leg, or something where you would say, obviously you have some sort of, there's not a broken bone or anything. So I felt like I I really had to weigh the safety of seeking out treatment in person, and that's really what I've been struggling with is trying to make sense of what does make sense.
Right.
I'm still struggling because I don't know. I still don't know if I feel comfortable with how much risk to take. So there's still risk. There's still risk, and to me, that's been the scary part of this is you can't really mitigate it. You're taking your chances no matter what you do.
So for you right now, that weighs more than whatever's going on with your knee.
I mean, I'm I've had discussions with friends about how long do we stay like this, and I feel like we know that there is some type of vaccine coming, and they're estimating that will be widely available probably sometime this next year around this time. So it's sort of like, can we hang on another year? Well, yes, I need to get the knee looked at, and I do because it's painful. But what if that's the thing? And that's the fear. What if that's the thing that does it? What if getting care is the thing that actually, what exposes me?
If it's true that we really do understand that it's perilous to neglect medical care, I'm wondering, why are we doing it? Why are nearly half of American adults staying away from doctors' offices and medical facilities, even if they know these practices are taking extreme measures to protect their safety? What's going on inside our heads?
People are isolated. People are, locked in. And so there already is an increased number of domestic violence and child abuse. There'll probably be a number of other mental disorders, substance abuse, even PTSD in some instances, definitely depression and anxiety. There'll probably be increased alcohol and substance abuse or dependence. There are some long-term effects that are already in effect.
I'm speaking with Dr. Michelle Linden. She's a clinical psychologist practicing in San Diego, California. She specializes in PTSD, which somehow seems fitting in this situation. From a mental health perspective, what do you think? Do you think we're headed for a secondary health crisis in this country?
Oh, well, we're definitely headed for both medical and psychological health crisis, and I have a feeling the consequences are going to be, of course, short-term, but we're going to have some long-term effects.
As doctors' offices are opening up, people still won't go in for their essential healthcare needs because of the fear that they'll contract COVID.
Right. I think people are afraid that once they're out and in a doctor's office where people are ill, they'll pick up something. Also, there's a strange phenomenon with most people. They're afraid to go to a doctor when they have a symptom because they're afraid they're going to have what they think they have. In other words, I have a pain here. I'm afraid it's cancer, but if I don't go see a doctor about it, I don't have cancer. So there's a great deal of reluctance because of the fear they might have something. It's kind of a contradiction, but there are individuals who are simply afraid to go see a doctor for fear they'll be diagnosed with something. I think basically those two are the main reasons. One, they'll catch something, and two, they're afraid that they already have something and don't want to hear about it. There's definitely an increase in anxieties and fears and depression and a lot of behavioral problems as well.
What would you recommend to people to get past this?
But there's a lot of information out there about where to seek help during isolation, during the lockdown, during the introduction of coming out of isolation. There are mental health facilities that are out there, but I don't think people have access to them.
Let's say you have a patient who is telling you that they have some kind of health condition, but they're just too afraid to go see their doctor or go have an x-ray or have some kind of screening because they're afraid of getting COVID. Like, what would you tell them so that they could psychologically get past that fear and go take care of their health?
Well, I give them the option of weighing the two. You have a medical condition which makes you more vulnerable to the infection and makes you more vulnerable to the more serious effects of the infection. But if you weighed the two, if you have a medical condition that could cause serious damage to your body versus COVID, which is also potentially fatal, but also has a lot of care surrounding it, well, which is it? It's an if-or, devil's choice. I would suggest people continue to try to take medical care, wear their masks, take all the precautions. Most doctors' facilities, doctors' offices, medical clinics, hospitals are taking extreme measures to prevent infection. So they're more likely to get an infection or to be exposed by not going and then being vulnerable because of an illness than if they went through all the precautions that all these medical facilities have to get that problem taken care of.
I don't know about you, but sometimes I feel like time is standing still. It's like we're just waiting for this pandemic to end so we can get on with our lives. But the truth is, while we're in this sort of holding pattern, our bodies are still aging, diseases are still growing, cancer cells are still spreading. So I think when you listen to everything we've heard here today, the bottom line is you can't neglect your health. This really is about the big picture. If you need to see a doctor or have an x-ray or get a cavity filled and you're feeling nervous because of COVID, you can call your doctor's office. Ask them what they're doing to protect you. How often are they cleaning? How is the waiting room set up? Can you wait for your appointment in the car? A lot of places are letting you check in for your appointment from the car so you don't even have to sit in a waiting room at all. Do what you need to do to feel safe, but at the same time, take care of your healthcare needs. This is about your health. This is about your body. Next time on Your Body, we're talking about prostate health. Did you know that 1 in 9 men will be diagnosed with prostate cancer during his lifetime? Or that prostate cancer is the second leading cause of cancer death in men in the United States? The way doctors diagnose prostate disease seems to be constantly changing, and treatment of prostate cancer is evolving rapidly. So what's a guy to do? Tune in next time when we try to get some answers. Thanks for listening. If you want to learn more about this healthcast or some of our guests, please visit www.yourbodyshow.com. And if you'd like more information about RadNet, check out www.radnet.com. Your Body is produced by Steve Kramer, Doug Smith, and me, Stephanie Landon. Executive produced by Paul Colacchio and Karen Morad, all on behalf of RadNet. Original theme music by Mark Lakier. We hope you've enjoyed our healthcast. Find us wherever you download podcasts.